You as a cardiologist, what would you say are like one of the best ways to keep your heart healthy in general?
Yeah, that's such an important recognition and question, Catherine. And I think if somebody's just looking to get started in terms of how to make sure that they've got a healthy heart, it really starts with being an active person to the extent that that's possible and making sure that they understand what a healthy diet is. We have an immense array of medications and diagnostic tools and procedure and surgical capabilities to keep sick people well or healthier than they might be without that. But it really starts with just a healthy lifestyle and embracing that as part of your identity and making regular exercise part of your identity, making healthy food choices
Mm.
part of your identity and sharing that with your family. And I think we also don't necessarily focus on this enough, but more and more we recognize that stress is an important risk factor in cardiovascular well-being. And today's times are just as confusing and stress causing as any other. And I also like to emphasize that having healthy relationships in your family is important too. And
That's
not
true,
just your
right?
family, but
Mm-hmm.
your friendships, right?
Mm-hmm.
Professionally, personally, it seems like it's a little disconnected. It's not. Having healthy relationships in your life is important for heart health.
Interesting. So basically, emotional health and mental health are all factors for heart health.
I look at it as fundamental. In the people who need material improvement in other more physiologic cardiovascular risk factors, improving weight, improving blood pressure, improving cholesterol, improving their A1C by changing lifestyle habits. It starts with having a good relationship with yourself and those closest to you so that you have enough self-esteem to begin working on some of those things that might be difficult to otherwise.
Very interesting.